hyper personalization at scale, like that's kind of been thrown around as like very buzzwordy terminology for the better part of 10, 15 years. And I think we finally arrived at the moment where it's all possible, not just in that way, but across multiple sessions, across multiple channels. And I think really, really importantly, with this like notion of persistent customer memory, so that when you go back and interact, it's like the continuation of a long-term conversation, which I think is super exciting.
So speaking of customers, can you provide a specific customer success story where sort of AI-driven features created a clear competitive advantage in ROI?
Yeah, I'll give you an awesome one that's actually really a hard one as well. So there's an organization that we do business with called OhMD, and I'm using this example because, in the world of healthcare, the first thing that you run up against is HIPAA, right? And clearly, healthcare providers care deeply about HIPAA because of the regulatory aspects of it, to be sure, but also the consumers that they interact with, they care a ton about privacy. And you want to make sure that great care is taken in when you're interacting with a patient, you're using data to be able to inform a better patient experience, but at the same time, you're making sure that that data is effectively made obsolete at the end of the conversation. And so what we've been able to do with OhMD is basically help them create, using our conversation relay product, a voice AI assistant that their consumers can avail themselves of to be able to handle a patient call through virtual capabilities, get questions answered that involve like rich healthcare concerns. We use our segment capabilities, our data capabilities under the hood so that there is this persistence in terms of customer memory so that if a patient calls back, it doesn't feel like the first time that they've called all over again. It allows them to kind of navigate, what we've become used to, unfortunately, is like this endless menu of IVR menus and repetitive information. Like that's all gone. And it allows to the extent that a call has to escalate to a human agent because the problem can't get solved, they can now engage with a much richer, much deeper level of understanding with insight that they can now bring to the conversation. And what we're starting to see with OhMD is that they've got a 60% lift in the self-serve capability to be able to actually resolve calls.
Wow.
They're able to drive the conclusion of these calls in less than a minute in many instances. And if you just kind of consider the scale at which they operate, they estimate that by the year 2026, they'll have 55 million plus patient interactions happening in this way. And so I could have used an easy example. I thought I'd pick a hard one because I think
It's a
it
good
really
one.
goes to show, just how powerful this technology is. And if you can do it in healthcare, you can rapidly take it to things that are also hard, like financial services or insurance, real estate. And then it just makes the proof points when you go to retail and e-commerce and stuff like that, like really, really powerful.